Good afternoon, everyone. I am Nirav Shah, I'm the Director of Maine Center for Disease Control, and I'm delighted to join you to provide an update on all matters COVID-19 across the state. Let's start with where we are in terms of our case numbers. At present, there are 4,713 cases of COVID-19 across the state, representing an increase of 12 cases statewide. Of those, 4,244 are confirmed, an increase of 14, and 469 are probable cases, a decrease of 12 cases. Cumulatively, 429 individuals have been hospitalized, and right now in the state, there are 7 individuals who are currently hospitalized, 6 of whom are in critical care, and 2 of whom are on ventilators. Sadly, 134 individuals have passed away with COVID-19, the same number as is yesterday, and 4,086 have recovered, an increase of 10 recoveries since yesterday. Cumulatively, 999 healthcare workers have been affected by COVID-19, 933 of whom have recovered and have been released from isolation. Overall, since Maine CDC began our activation, our epidemiologists have fielded now almost 12,700 requests for consultation. In addition to that, our colleagues over at 211 have fielded now over 35,000 calls specifically related to COVID-19 since we began our partnership with them over 6 months ago now. This is a great opportunity both to thank everyone at 211 as well as to remind everyone out there that that remains a great resource for discrete questions that you might have about COVID-19. I'd like to turn now to some updates on some of the outbreaks in which Maine CDC is involved. And let's start by noting 2 outbreaks that Maine CDC has just opened. One is at the Lafayette Club in Sanford, where there have been 2 staff members and 1 patron associated with that organization who have tested positive for COVID-19. The other outbreak that we recently opened was at the Sanford American Legion, which recently hosted a reception following a funeral. We've traced 4 cases of COVID-19 to that event. Again, both of those new outbreaks are in the Sanford area. One big outbreak that we just closed is that at Sedgewood Commons. As many of you are aware, that had been a long-standing outbreak associated with that facility. And after now a total of 59 cases of COVID-19, we have just closed that outbreak. For everyone's reference and awareness, Maine CDC closes outbreaks after there have been 2 consecutive incubation periods with no new cases. In the case of COVID-19, that means a facility or an organization has to go 28 consecutive days with no new cases in order for us to close the outbreak. That definition is the same one we apply to just about any infectious disease. Whether it's measles or whether it's COVID-19, we use 2 consecutive incubation periods as the benchmark for when an outbreak can be closed. I'd now like to provide an update on outbreaks associated with the August 7th Millinocket wedding. As of right now, there are 158 total cases of COVID-19 associated with the August 7th wedding in Millinocket. Sadly, there have been 3 individuals who have passed away related to their exposure to COVID-19 associated with this outbreak. One important point there is that none of these 3 individuals who has passed away attended the August 7th wedding themselves. This is just another example of how quickly, silently, and efficiently COVID-19 can spread and the ways in which it can affect individuals who may not have even been at the initial event themselves. Of those 158 cases, to break that down a bit more, there were 55 cases now that we have identified among wedding guests, as well as their secondary and tertiary contacts. One of those cases was a secondary contact of a guest who also happened to be a staff member at Maple Crest. As a result of that, there have been 20 subsequent cases associated with Maple Crest, 9 among residents and 11 among other staff members. In addition, there was a staff member at the York County Jail who also attended the wedding. In part because of that individual's exposure, there have been 17 other staff members at the jail, as well as 48 inmates at the jail who have now contracted COVID-19. In addition, there are now 7 family members of staff at the jail who have confirmed infection and 9 family members of staff who have probable infections. This is, again, evidence of how quickly and how widespread COVID-19 can become after large initial events like this August 7th wedding. It really is a constant reminder for us about how COVID-19 can appear literally in the places where we least expect it to. As we come off of a holiday weekend, and as we look to the weather becoming more cool and individuals starting to socialize indoors as opposed to outdoors, weddings of this nature, events like this nature, are a perfect reminder of what can happen where there is a long duration event with a high number of individuals where mask wearing was not the norm.
Mark that.
Finally, a couple of updates around testing. Let's start with positivity rates. Yesterday, based on 2,679 PCR tests reported to Maine CDC, the one-day point positivity rate was 0.75%. That brings our 7-day weighted positivity rate now to 0.55%, 0.55%. For reference and context, the national average of positivity rates remains at 6%, and the rate in Maine is 0.55%. In terms of testing volume, our volume right now is 362 PCR tests for every 100,000 people in Maine that are being currently conducted. Again, to put that number in context, the national average for PCR testing is 224 tests for every 100,000 people. The rate in Maine is 362. And finally, a quick update on PCR tests among individuals from out of state. As of right now, there are 238 test results among individuals from other states. This is out of a total of nearly 8,000 test results among all individuals from out of state. And of those, 238 have been deemed to be positive. Just to go through that one more time. There have been now close to 8,000 tests run on out-of-state individuals across the state of Maine within our borders. And of those, 238 cumulative. If you guys, sorry, I'm just gonna throw everyone on mute real quick.
Well, you're not muted.
Okay. But as it happens, we are actually going to turn to our colleagues in the media. And so we will go ahead and toss things over to Brian Sullivan, who's got today's first question.
Thank you, Dr. Shah. I'm going to blame that on our control room. That was not me. There. I have a couple of questions for you. If you just with the August 7th wedding in the Katahdin region, where the case total rising to 158, can you just talk a little bit about the process and dealing with the people who've been affected by it? And are you happy, unhappy with the way it's been handled and as the case count has started to go up to nearly 160, but it was rising pretty fast, and now the numbers are leveling out a little bit, perhaps?
Sure, Brian. Let me start by just noting something that we noted in these briefings, but haven't touched upon in a while, which is that every single one of these case numbers is a person. And sometimes, especially when we talk along epidemiological lines, there's a tendency to forget that behind every one of these numbers is an individual. And especially as we've been contending now with 3 individuals who have passed away, I'd be remiss if I didn't ask everyone to remember that every one of these cases counts. And let's not get too wrapped up in the numbers. And if we do, please remember that each and every one of these was a person. Brian, thus far, we've had great cooperation among individuals who may have attended the wedding or been involved with one of the follow-on outbreaks, whether at Maple Crest or that associated with the York County Jail. I think what we've learned, and is important to keep in mind, is that these situations can be quite jarring. All of a sudden you are finishing up a celebration, and then you get a call from somebody who says they're from the Maine CDC and wants to talk about an exposure you might have. Given that potentially jarring series of events, the cooperation that we've had has been quite robust. We've been able to work with folks to figure out who their contacts were, and that's allowed us to make recommendations around things like testing for close contacts, as well as allow us to check in with folks to see how they're doing and how their symptoms are evolving. So clearly a situation of high concern, both to us, but clearly to the individuals who have been affected.
And if I could just, one maybe more broad question. Before or last weekend on Thursday, you asked us to not undo the work that we've done for the past 6 months. What are you hearing from your colleagues, maybe on a national or global level, about where do you see the next 3 to 6 months? Where do you see us as we move forward here?
Sure, Brian. I'll pick up on the thread that I mentioned. So certainly one concern that my colleagues and I share right now is the next 10 to 12 days. We've seen both with Memorial Day and then again with the 4th of July that COVID-19 loves holidays. And after both of those prior holidays, there were upticks across the country, notably after Memorial Day, somewhat less pronounced after the 4th of July. So that's a very immediate concern that I share with my colleagues across the country, here in Maine as well as nationwide, the possibility in the next 10 to 12 days of an uptick. But looking more into the future, as I mentioned a moment ago, as the weather starts turning cooler, activities will continue, but they may move indoors. And thus we might lose the protective effect that being outdoors has. Wearing a mask when you're indoors is not something that's on anybody's list of things to do when you're at a dinner party, for example. But there are things that folks can do even when you're celebrating with friends and family indoors, staying as far apart within the living room as possible. And if you're with folks that you may not know or may not be in your tight circle, wearing a face covering is a great way to protect yourself as well as others. So that's something we're worried about in the immediate term. Looking just a little bit longer term than that, Brian, I'm not going to categorize this as a worry or a concern, but it's something we're very focused on preparing for, and that's the eventual rollout and introduction of a vaccine. I talked about this as well, but again, an opportunity to underscore that since late April, early May, Maine CDC has been working with stakeholders across the state, healthcare workers, logistics experts, you name it, to start preparing for the rollout of a vaccine. We'll be ready when the vaccine is ready. That's my message for everybody right now, and that's certainly a very high area of focus for us. I'm going to turn to Amy Brown next.
Sorry about that. Thank you, Dr. Shah. Any updates on the Calvary Church in Sanford and whether or not that's epidemiologically connected to the outbreak in Millinocket?
Sure, Amy. So right now, there still remains 10 cases of COVID-19 associated with the Calvary Baptist Church in Sanford. We have been investigating several different hypotheses, as well as reports that have been given to us about putative connections between the church and, say, the York County Jail outbreak or the Millinocket wedding situation. Thus far, none of those has satisfied our strict epidemiological criteria for when we deem something to be linked. There are certainly certain connections among those individuals who may have attended one or more similar events, for example, but it's got to be more than just saying someone was at the same event. It also has to line up from a disease transmission perspective as well before we can link them epidemiologically. Thus far, we haven't met that very high scientific threshold, but we're still looking into all the reports and matching up when folks were there, when they started developing symptoms, things of that nature. And it's not until and unless we satisfy those criteria that we conclude that there's a linkage.
And you're getting good cooperation there as well?
We've gotten cooperation from parishioners, congregants associated with Calvary Baptist Church, and we're continuing to make sure that we can get all the information out on the table. These are, of course, multifaceted types of situations, and the more information we've got, the easier it is for us to spot any of those epidemiological links.
Okay, and I have one other unrelated question, if I may. Is there any indication yet of what, and I think there must be, because the putting together the flu vaccine, looking at what possible flu strains are going to include in that this year, is it thought that this will be a average flu year, or the strains that they're preparing for, are they better or worse than average flu years?
Sure, Amy. Let me just follow up on something you asked in your prior question, just for completeness. My office has been in touch with Pastor Bell. As I mentioned last week, one of our representatives in Southern Maine communicated with him by email. I followed up with that communication on Friday from me directly to the pastor to make sure that he was aware of public health recommendations, as well as where we were thinking about this in terms of ways to keep everyone safe. So we have made those linkages, we've made those communications to make sure that the pastor, as well as everyone in the church community, is well aware of where things stand and just how seriously we're taking this. Let me answer your question about the flu season. The bottom line here, Amy, is that it is very difficult to predict exactly what sort of flu season we will have. There are those out there who say, well, the flu that has currently ended in the Southern Hemisphere was not so bad, and thus perhaps the flu season that is working its way toward us here in the Northern Hemisphere will similarly not be so bad. That is far too facile of a conclusion. Even in the Southern Hemisphere, it was still a bad flu season. And of course, individuals there were physically distancing. So it's really difficult to know what the magnitude of impact this upcoming flu season will be. What I will tell you is that the co-occurrence of flu with COVID-19, something of a twin-demic, if you will, is very concerning. And if you have previously been on the fence about whether to get a flu shot in prior years, this is the year to make sure that you and everyone in your family get one.
Thank you.
I'm going to turn to Steve from WMTW.
Doctor, thank you very much. A couple of school-related questions. First of all, what specifically needs to change in the next 2 weeks for York County to move from yellow back to green?
Sure. So, Steve, the way I'll answer your question is both sort of how we think about counties going from green to yellow and then the reverse course that you noted. And I think where I want to start, Steve, is by noting that this is not a pure mathematical formula that we plug some numbers into and out spits a color. Although we certainly take a hard look at all of the metrics, there are also qualitative factors that go into this. As I mentioned last week, about half of the open outbreaks in the state of Maine are in York County. In fact, that's even more than half now with the addition of 2 more outbreaks, the ones that I mentioned earlier. So there are quantitative factors as well as some qualitative factors. The factors that I think weighed most heavily on our committee, among many, were the fact that the positivity rate in York County was about 3 times the state average, and the rate of new cases of COVID-19 in the preceding 14 days was significantly higher than the rest of the state. So certainly progress on both of those fronts would be necessary. The question is whether that would be sufficient. And for that, we have to take a look at how the contours of these outbreaks go. As there are more and more outbreaks in York County, what that tells us is that there is ongoing, sustained community-level transmission. And even with a low number of cases or a low positivity rate, the presence of that community transmission is something that gives us pause, because that's a situation where a few cases in the community could generate an outbreak in a school. So there's not a formula, but we do simultaneously take all those things into account.
Thank you very much. And my second question is about the RSU 57 staff member that tested positive. The superintendent said that the CDC has determined this person is not a close contact. Could you elaborate exactly what that means?
Sure, Steve. I generally don't comment on individual cases for a number of reasons. But what I will say in this setting is that when we think about close contacts in the school setting, what we are referring to is two things. The first is when we think about close contacts in general, we are referring to individuals who may have been within 6 feet for at least 15 minutes, if not more. And those individuals who are within those parameters are deemed to be close contacts. In this setting, what we do as soon as we are alerted of a case and we determine that that individual works within a school, we have a specialized set of questions that we ask, that our case investigator and contact tracers go through, that help us dig several layers deeper because of the importance of school settings. And we talk about others who may have incidentally come into contact, settings where the individual may have been in a room with students, but not for X number of minutes at one time, but over the course of a day, for example. And we go through those far more detailed analyses. And in this setting, we determined that the individual had not met the criteria to be a close contact. Or, sorry, that there were no individuals in the school who met that criteria, which is an encouraging sign. I'm going to turn next to Bob Evans at News Center.
Good afternoon, Dr. Shah. You mentioned the vaccine. When a vaccine is eventually released, do you think it will go out to everyone at the same time, or do you think it will be staggered or only released to a specific group of people at first?
Sure, Bob. This is a topic that has certainly been one of national discussion lately, and it's one I think we're going to continue discussing. So, Bob, the day a vaccine is fully approved, released, and ready to go, nationwide, on that day, there will be far more demand on day one than there is supply. And that a mismatch between the supply that we've got and the demand that we have may persist for several weeks, if not longer. No one's quite sure at what rate vaccine will be available. One of the things that's been happening both at the federal level as well as in Maine is the beginning of a dialogue, a discussion, a conversation around who, given that reality that there will be more folks who want it than we've got, who should be at the top of the line in that situation. Just not too long ago, the National Academy of Science released a draft document to kick off this discussion in which they tried to order or come up with a system as to who might be in line first and then how we would progress through that line. That document is publicly available. It's available on their website. I encourage everyone to take a look at it and see what you think. What this expert committee at the national level started thinking about were folks like frontline healthcare workers who we need in order to keep treating people, as well as, for example, individuals who are in long-term care facilities and the staff who take care of them. And then a progression thereafter, looking at first responders, thinking about those who work in congregate settings, so on and so forth. This is a discussion that's happening at the national level. As we get closer to having a vaccine, it's one that I think will occur within our own neighborhoods and our communities as well.
Okay. And also, this is a viewer question. Many nursing homes or long-term healthcare facilities established rules to have outside family visitation only at their locations. That happened since some of the earlier outbreaks in those types of facilities, where it's important for these people to have contact in their interactions with family so that they're not isolated. A woman from Hamden asked what the Maine CDC is recommending to these facilities about family visits when it gets colder.
Mm-hmm. So this is going to be a challenge as we go into the cooler weather months. It's similar to what I mentioned a few moments ago in connection with Brian's question. As we get into cooler months, a lot of the activities that we've taken outside because of the protective effect of being out of doors may have to come back inside. Now, in the setting of visits to loved ones in nursing facilities, this problem is far more challenging because we can't just move them inside. What I will say, Bob, is that not long ago, the federal government released a roadmap for how nursing facilities can begin the process of resuming indoor, in-person visits between residents and their loved ones. It's a long process, as you can imagine, because safety has to come first. And some of it depends on things like staff testing of employees at the nursing facility. Some of it depends on the background rate of COVID-19 in the community. We have been working with nursing facilities across the state to help them on their journey using this roadmap so that they can get back to indoor, in-person visits. It's a long journey. So I think as we go into the fall, as more testing is occurring within nursing home staff, we'll have a better sense of what's going on. That being said, I can't today tell you what date on the calendar in-person visits will be available. As with all things COVID-19, it will be the data that drive that decision, not a specific date.
Okay, thank you.
I'm going to turn now to Charlie at the BDN.
Yep. Hi, Dr. Shah. Thank you. Sorry, can you hear me? I just want to.
Yep. Go ahead, Charlie.
For a minute there. Okay.
Loud and clear.
So I guess my first question is related to the two newly identified outbreaks in York County. Do you know how mask wearing was at either of the funeral reception or in the Lafayette Club? And then more generally with the Lafayette Club, do you know, was that any kind of event or just people who just happened to be getting a drink there, something like that?
So Charlie, asked you your former question. We've just opened both of these outbreak investigations very recently. So we don't yet have a good sense of what degree of face covering wearing was observed in either setting. Hopefully we will in the coming days, but as of right now, we're just in the beginning phases of our analysis and our investigation. And as to the Lafayette Club, we don't believe it was tied to a specific event or celebration. As we understand things right now, these cases were detected over a somewhat longer period of time. We don't exactly know what that span of time was, but we don't think at this time it was a discrete point event, unlike the reception that was held at the Sanford American Legion, which appears to be a discrete point event that was held after a funeral.
Okay, and then to follow up on that, how has Maine been treating social clubs generally, such as an American Legion or a Lafayette Club type place, in its COVID restrictions? Has it been similar to restaurants or more or less relaxed for them?
So we view them, so there's two lenses through which we look at facilities of this sort. The first is just the straight epidemiological lens. And for that, it's immaterial from a epidemiological lens, whether it's a social club, a restaurant, a bar, a house of worship, a gathering using those lenses is a gathering. And when we do those epidemiological investigations, we're focused on who was there, how long were they there, who was sick, who was the first person to get sick, things of that nature. That's one lens. And so through that lens, Charlie, we look at any gathering of individuals the same. The other lens, however, that we look at things through from a public health perspective is more of the licensing in the way that we would license a restaurant or a lodging establishment. In this setting, I don't believe that Maine CDC licenses the American Legions. And I will check and see where we are in terms of licensure of the Lafayette Club. I believe we do license them in the same way as we would with other similar establishments. But for the specifics, I'll make sure we get back to you on that.
Okay. I guess I'm just, oh, sorry.
Well, no, in the early phases of any investigation, which is where we are right now, we're focused on the epidemiological lens. Who was there? Who were they in contact with? Who's sick? How can we get them tested? And then after we get our head around what's going around epidemiologically, that's when we turn to the next phase, which is what's the nature of the licensure authority and things of that nature.
Okay. And then just one quick sort of last question. Last week there was you touched on it today as well. There was a third death associated with the outbreak from the August 7th wedding. Can you confirm, was it a woman in her 80s from Somerset County? Was that the third death? They were, Maine CDC did announce a death that same day, but I don't know if they've been linked.
Charlie, yes, I'm just making sure from a privacy perspective. Yes, Charlie, I can confirm that.
Okay. Thank you. Appreciate it.
Yep. I'm going to turn now to Patty White at Maine Public.
Thanks, Dr. Shah. I've got a question about racial disparities with COVID. I've spoken with some of the people in the new Mainer community in Lewiston who a few months ago were saying they wanted more collaboration with the state. And now they say that things have really improved. There's really good collaboration and support for prevention and testing. And even though things are going better in that community, the rate of COVID-19 among the Black and African-American population statewide looks like it's improved a little bit, but it's still pretty high, around 20% of all cases. What can you tell us about how the rate is changing or not, and what else needs to happen to drive the rate down?
Yeah, that's it's very. Thank you for that question, Patty. I spent a lot of time over the weekend thinking about this exact issue, and I don't have a canned answer, but here's something that I've been grappling with as I've been thinking about this, as we think about the future of COVID-19, especially as we go into flu season. And it struck me, Patty, that many of the things that we talk about as recommendations to reduce the likelihood of either COVID-19 transmission, if you're a positive case, or developing and spreading, being affected by COVID-19, if you're a household member of a positive case. Many of those things are in and of themselves social determinants of health, in the same way that things like insurance coverage and having a car to get to your doctor's appointment are. The ability to isolate safely is predicated on having a job that allows you to have flexibility. It's predicated on having enough space where you live in order to do so. Or if you are availing yourselves of some of the social services that the state of Maine offers, which we've been ramping up quite considerably, being able to be comfortable being away from your family. And many of these things are themselves social determinants of health. They are predicated on a certain degree of privilege. And so as we think about moving forward with COVID-19 and getting a firmer grip on it, one of the things I've been talking about with my team is recognizing these challenges. And early on, we started by making sure that we were offering social service supports, safe isolation, food, connections with family members through making sure folks had iPads. But I think the next phase of this, Patty, is going to be going beyond offering and really ensuring that uptake is robust, because it's not enough for us to offer it. We've got to make sure that the folks that we're offering it to have all of these other things they need, like a job that allows them to be flexible, things like that, in order to take advantage of the social supports that limit their likelihood of transmitting COVID. So kind of a long answer, but it's been very much on my mind lately.
Okay, great, thanks.
I'm going to turn next to Joe Lawler at the Press Herald.
Yes, hi. I have a question and a follow-up. I know you said that you're just starting the investigation into the two new Sanford outbreaks. Is there any indication that they're linked to the Calvary Baptist Church? And related to that, is the pastor at the Calvary Baptist Church, is he following the CDC and the governor's executive orders? Do we know that? And then I have a follow-up after you answer that.
Okay. So, Joe, at this time, we do not have any evidence at this time that links either of these two new outbreaks either with each other or with any of the other existing outbreaks in or around York County. I want to stress that, again, we have just opened these outbreak investigations. As everyone is aware, it can take several days of interviewing individuals and working with them before those linkages become clear. So at this time, we're not aware of them, but that could very easily change in the next day or in the next week. And then, Joe, with respect to our communications with Pastor Bell, I am not aware of what compliance was like at any of the pastors' churches over the weekend. Again, we have sent Pastor Bell our expectations as to what guidance should be followed. One of our liaisons in York County did so last week. I followed up on Friday myself personally, but at this time, Joe, I don't have any insight into what level of compliance there was that was observed over the weekend.
Okay, thanks. My follow-up question is about, I know there's a lot of discussion about how contact tracing, can help control an outbreak like we saw at the Millinocket wedding reception and the others. But I'm wondering, is there also a connection between having the increased testing capacity and very low positivity rates to being able to control outbreaks? Thanks.
Yes, the answer, Joe, is yes, there is. Now, clearly, they work together with one another, so they're not wholly mutually exclusive, but it really is. Those two pieces, testing coupled with strong contact tracing, are the two foundational elements of any public health infectious disease response. Doesn't matter whether it's measles, tuberculosis, you name it. Testing coupled with aggressive, quick contact tracing are the two bedrocks. Testing is of course critical, and the positivity rate in particular, because it's an indication of how broad testing is being made available, and then B, whether we're testing individuals who are only symptomatic. If we're only testing folks who have symptoms, given how many individuals with COVID-19 are asymptomatic or pre-symptomatic, we know we're missing folks. So testing is really critical. And then of course it is the testing that directly informs the contact tracing. Once folks are positive, we then follow up with them. So that's an obvious linkage, but really they are very intimately connected. You can't have one without the other. They are both necessary to have a good response. I'm going to turn now to Dustin at New England Cable News.
Hi, Dr. Shah. I was wondering, overall in York County, are things getting better, worse, or staying the same?
As of right now, as compared to, say, this past Thursday, Dustin, I'd say they're about the same. We'll have in the next day some of the updated numbers with respect to positivity rates, as well as the number of new cases. But as of right now, things are largely the same as they were last Thursday in York County, which is to say of high concern. The addition of now 2 more outbreaks raises that concern level even more. So now what we have in York County are several multifocal outbreaks across the county. No matter which scenario we find ourselves in, they are concerning. One scenario is that, for example, these 2 newest outbreaks are not related in any way to the existing outbreaks. That's concerning because it suggests that community transmission is getting to a certain point that it's generating outbreaks. It also suggests that things like face covering wearing are not where they need to be. The other scenario, which is that all of these outbreaks are in fact interconnected, is itself concerning because it means that the public health advice to stay indoors, to observe quarantine, isolation, wear face covering, stay distant among folks who have been part of identified outbreaks is not getting there. So no matter which scenario we ultimately uncover, the fact that we've now got 2 more outbreaks in a 36-hour period in the area where there was already high transmission is deeply, deeply concerning.
And do you have an overall number of outbreaks in York County that you're looking into right now?
Yes, it is. In fact, just for clarity for everybody, I'll just kind of walk through them really quickly. So right now in York County, here is what is of concern. We've got Calvary Baptist Church. We've got the Lafayette Social Club. We have the Sanford American Legion, the Sanford Fire Department. We've got the Seal Rock facility, and the York County Jail.
And given what we know about outbreaks across the country, is it just too early to tell when this region might get back to quote unquote normal?
You know, it is too early to tell, Justin, but on top of that, this is something that is, you know, we call upon residents of York County. This is within their hands as well. Things like aggressive face covering wearing, keeping physical distance from one another. If you've been identified as a close contact, staying in quarantine. These are the bedrock principles that we've been following and recommending. This is an opportunity for folks in York County to do their part and help keep these numbers low. At this time, it's too early to tell or predict when things might fall back to a baseline, but this is a solvable issue. We've contended with spikes like this, and we know that what's gotten them under control is testing and contact tracing on the Maine CDC side, but also face covering wearing, physical distancing, things of that nature at the individual level. So we've all got a part to play here. And the final question of the afternoon goes to the ever diligent Patrick Whittle.
Thank you very much. This is a sort of extended remix version of an earlier question. So around the country, as you mentioned, the percent positivity rates in a lot of states are trending in different directions than Maine, but there are some that are sort of flattening out. And I'm curious if the restrictions could be amended sometime soon regarding some of the other states, because we've been in this sort of 5 states okay, 44 states not so okay mode for several weeks now. And I'm curious if the calculus has changed with several weeks of staying around 1% in some of these other states.
Yep. So Patrick, we take a look at the numbers from other states nowadays, not just in the Northeast, but actually pretty broadly across the entire Eastern Seaboard and into the Midwest. And because we want to make sure we're not just zeroing in on the Northeast at this time. We took a look at the numbers not too long ago, just a couple of days, in fact. Late last week, we took a look at the numbers from a number of different states, and we didn't see anything that prompted us to move another state into the can visit without a negative test or 14-day quarantine. So, for example, the positivity rate in Massachusetts, this is as of Friday, at the time was 1.8%. Their number of new cases per million people in the last 14 days, as of last Friday, was 769 new cases per million. For comparison, the rate in Maine is 248. Rhode Island, for example, as of late last week, had a positivity rate of 1.3%. And their number of new cases per million over the past 2 weeks was 1,211. Again, for comparison, the rate in Maine, 248, and our positivity rate, 0.55%. So we also, again, are also checking to see whether the states that we have granted these exemptions to have worsened in a material fashion such that we would put the requirements back in place. and we haven't seen any appreciable change that would have prompted us to put those requirements in. So even as to Rhode Island and Massachusetts, we're not there yet.
Some other states that take the same approach, the states that they open up to don't have to touch, and like our map, albeit in a somewhat circuitous way, does. Is it possible that a state like say Colorado, somewhere that's not close to here at all, could possibly be added before another state in the Northeast?
Yes, it is possible. In fact, we were debating this not too long ago in the same meeting where we were looking at states in the Northeast. We were also taking a look at other states, just kind of more generally across the country, to see where we might add. There were some states that we have been looking at for that in that respect, Patrick. We haven't made any final decisions because none of them really met the strict criteria that we had in place. We also compare that to what we know to be, for example, the number of individuals who visit from those states, and they weren't that high at all. The vast majority of visitors are accounted for by other states in the Northeast. But as we go into a longer term with this model, we are looking into other states across the country that we would add, because of course, as more folks are resuming their safety with flying, for example, we want to make sure we're clear with those visitors. So very much on our horizon.
Okay, thank you very much.
Yep. All right. Well, thank you all for taking some time this afternoon to join. Apologies for the audio difficulty at the beginning. That's on me. One of these years, I'll figure Zoom out. But I'd like to thank everyone for their time this afternoon. Thanks to all our colleagues in the media for their questions. As always, please be kind and take care of one another. We'll talk again on Thursday.